gather equipment, check medication order against the original physician's order according to agency policy, and then clarify any consistencies, check the patient's chart for any allergies. And then know the actions, nursing considerations, safe dose ranges, purpose of the administration, and adverse effect of the medication to be administered. Consider also the appropriateness of the medication to this patient. For example, we will be administering oral such as paracetamol for the kids, a syrup wherein this medication is for painkiller such as headache or body ache, and then perform hand hygiene. And then move the medication cart to the outside of the patient's room or prepare for administration in the medication area. Unlock the medication cart or drawer, and then enter a passcode and scan employee identification if required. Prepare medication from one patient at a time. Read the medication administration record or the MAR, and then select the proper medication for the patient's medication drawer or unit stock. And then compare the label with the MAR, check expiration dates, and perform calculations if necessary, and then scan the barcode on the package if required. Prepare the required medications. Prepare the required medications. For unit dose packages, place unit dose package medication in a disposable cap, and do not open wrapper until at the bedside. Keep narcotics and medications that require special nursing assessment in separate container. And then if multi-dose containers, when removing the tablets or capsules from a multi-dose bottle, pour the necessary number into the bottle cap, and then place the tablets in a medication cup. Break only scored tablets if necessary to obtain the proper dosage. Do not touch tablets with the hands. Liquid medication in multi-dose bottle. When pouring liquid medications in a multi-dose bottle, hold the bottle so the label is against the palm. Use the appropriate measuring device when pouring the liquid, and read the amount of the medication at the bottom of the meniscus at eye level. Also wipe the lip of the bottle. With a paper towel. When all the medications for one patient have been prepared, check the label with the MAR before taking them to the patient. And then replace my multi-dose containers in the patient's container or unit stock. Then lock the medication cart before leaving. And then transport medications to the patient's bedside carefully and keep the medication in sight at all times. Ensure that the patient receives the medication at the correct time, and then also identify the patient. Check the name bag, and then ask her to state his or her name, and then if the patient cannot identify him or herself, as the significant others or other patient for the second source. Then complete necessary assessments before administering medications. Explain the purpose and action of each medication to the patient. Ma'am, I will give you this paracetamol syrup for you to be able to lessen the pain that you are feeling right now, and then assist the patient in a upright or lateral. Assist the patient in the upright or lateral position. For administering the medications, offer water or other permitted fluids with pills, capsules, tablets, and some liquid medications. Ask whether the patient prefers to take the medication by hand or in a cup. Ma, what do you take? What do you prefer if you take the medication? You want it to be on the cup or you want it on hand? Okay, ma'am. In with the patient until each medication is swallowed, and then never leave medication at the patient's bedside. Perform hand hygiene. And leave the patient in a comfortable position. Then check on the patient within 30 minutes or time appropriate for drugs to verify response of the medication. And then document the procedure in the patient's chart.